I think the most important thing I'm taking away from today's roundtable debate is around adoption and the role of data. In particular, we discussed in the roundtable the fact that in many instances there isn't the same kudos or reward associated with adopting best practice as there is in being an innovator in your own right. So we need to look at that, but also what are the kind of catalysts, if you like, for adoption of best practice. And there were some interesting discussions around that as to, for example, we need to make it black and white. That came from Anant Jani. From that, really, I interpret, well, you need to get to a point that says, why wouldn't you adopt best practice? And I think the role of data is so important in doing that, in assessing your benchmark position and being able to then compare not only within England but also beyond England. How does that sit with respect to other practices?
It's fascinating for me when I look into the NHS as somebody who works in industry but clearly has a very, very close association with the NHS, and you think about, so who do you go to if you're an innovator? Who do you engage with? Is it the clinical colleges? Is it NICE? Academic health science networks? NHS England? NHS Improvement? STPs? And the list actually goes on. I'm absolutely sure that's not an exclusive list. And so I think it's a very complex environment that we've managed to carve out for ourselves, and I think that simplification of that environment would be beneficial for all.